I'm a recovering person, and of 26 years.
Awesome.
And I had some mentors years ago that mentored me and told me that I would be, I was suited for this type of work.
Yeah.
So I started out at the entry level and then attended college back in 1995 and, pursued my career. And I've been in the profession ever since, starting at the bottom from 1991. I've been in the Lakeview Health system as an employee since, I believe it's September of 2010.
Cool.
And I'm originally from Pennsylvania, so
Okay.
I moved to Jacksonville, Florida in 2009.
Okay. What part of Pennsylvania?
I lived in the state capital. I'm from Philadelphia, but I lived in Harrisburg, Pennsylvania.
Okay.
And I've worked in the field for 20 odd years. My degree is in human services. So I'm a human service major. So my degree expands more than just counseling. So there's administrative component and I've actually done lobbying too as well. So I just wanted to get the clear understanding of how the administration process worked, and I facilitated I directed a couple of programs, but I wanted to know the insides and outs and the best way to help the suffering addict and alcoholic, at every level. First, getting started when the patient first enters the program, okay? But specifically in the outpatient group, what we do is we identify any barriers that can interfere with the patient's. Well, first we identify long-term recovery goals, and then any barriers that might interfere with their long-term recovery goals with the process. And then we really work on the 12 steps, really like those first 3 steps of the recovery process, and really teach the patient mindfulness and meditation strategies to calm them down and to really work on surrendering, slowing their thoughts down, managing their mood, those types of things there. And then, of course, relapse prevention, teaching them relapse prevention strategies. It's really difficult for patients to hide in a group setting. Okay, so and there's a lot of research and history on group therapy and how effective it is, because the group patients feed off of one another in the group. So, someone may discuss an issue or a barrier that they're struggling with pertaining to maybe projecting negative outcomes towards their aftercare plan. Well, based on the size of the group, there will be other people that are struggling with that too. So it prompts a healthy discussion on positive strategies to remove barriers, and a discussion on just how to resolve that within themselves, which puts the patients at ease, because, and then they realize that it's not just them.
Yeah.
So they're not the only ones struggling with that issue.